Hey, what's up, you guys? Today we will be talking about heart failure. So, in summary, we have the left heart and we have the right heart. So, the right heart, this is the left heart. Left heart usually connect with the lung. And the lung connect with the right heart. Right heart connect with the rest of the body. Okay, so this is the human being. Okay. It's funny. Okay, so we have this right heart and left heart. Okay, so let me ask you a question. Now we will talk about heart failure. So the left heart, if the pressure increased in this point, okay, in number 1, if the pressure increased, why? Because if the heart fails to pump blood to the circulation, okay, fails to pump blood, okay, and the pressure increased, what do you think is gonna happen to the pressure here in number 2? Is it gonna be increase or decrease? Because the flow, the backup pressure, the fluid is gonna back up to the lung. So because there's more fluid in the heart, there would be more fluid in the lung. So do you think the pressure in the lung would be high or low?
High.
Excellent, perfect. So it's gonna be high. So if you have a lot of, usually the lung, what is supposed to be filled with? It's supposed to be filled with air. If you find fluid in your lung, what do you think? How are you gonna feel? Are you gonna feel good about it? No. No, you feel horrible. You're gonna have what symptoms you're gonna have? You're gonna have shortness of breath. You can have coughing. Okay, these are on history. On physical exam, you can find crackles. These are the lung sound when they have the fluid in them. Okay? So this is the problem. How about in the right heart? If there is a right heart failure, usually right heart, the left heart can cause right heart failure. Okay, but let's study them individually. So if the right heart, if the pressure here is high, let me choose a different number. If the different color, if the pressure here in number 1 is high, okay, what do you think is gonna happen to the pressure in number 2? So if the pressure is high, why? What does it mean? Mean the heart is unable to pump blood. The heart is lazy, so he can't pump blood. So the pressure is gonna back up. You will have a lot of fluid in the right heart. So this is gonna back up to the circulation. So the pressure in number 2, you think is gonna be high or low?
On the leg?
Yeah. Because there's gonna be more fluid in the leg. So if there's more fluid, the volume high, what do you think is going to happen to the pressure?
Gonna go high.
Gonna go high, perfect. So the fluid starts leaking where? To the circulation. And what is that going to cause?
Edema.
Edema, excellent. So leg edema. So leg edema, when you see that, is that a sign of a right heart failure or a left heart failure?
Right heart.
Excellent, perfect, excellent. So this is a right heart failure, okay? Another thing is that there is a vein that goes in the neck actually. So let me draw, it's actually in the neck. Okay, it's not a good drawing, but it's okay. It's called the jugular vein, the one in the neck. So if the volume is high in the right heart, so it's gonna back up. You will have a lot of more fluid because the fluid supposed to go to the lung, but they can't because the heart is tired or the heart failed to do its job. So you'll have more fluid here. The pressure is gonna go high. Okay? So what's gonna happen to the jugular venous pressure? It's gonna go high or low?
High.
Perfect, it's gonna go high. So that's why you're gonna have increased jugular venous pressure. So jugular venous pressure, is it a sign of a right heart failure or a left heart failure?
Right heart.
Excellent, right heart. So there's, okay, so this is the thing. Another symptom in the left heart, there are triad. Let's take that out. Okay, so in the left heart, you know, if the lung, you see the lung, imagine the lung like that. It has a fluid like this here. This is all fluid. This is when you are standing. When you're lying down, it's gonna be like this. So the fluid, how is it gonna be? It's gonna be like that. So it's gonna occupy more space. So what do you think is gonna happen to these patients? Are they gonna like sleeping in a flat position? Or they were gonna like standing more?
Standing.
Standing, perfect. So that's why usually when they sleep, they usually wake up in the middle of the night feeling breathless. We call it paroxysmal nocturnal dyspnea. Dyspnea at night. This is typical for a left heart failure. This is their triad, 3 symptoms. Number one is paroxysmal nocturnal dyspnea. The second one is called orthopnea. Orthopnea, which mean ortho, which mean the change in position. They have difficulty sleeping and lying down, and better when they stand. Okay, so this is the same thing. And the third one, they just have dyspnea, difficulty breathing, or exertional dyspnea. Okay, so these are the main 3 symptoms of heart failure, and the signs are jugular venous pressure distension. Okay, now there are very interesting mechanism after we found out all of these. Now we're gonna connect it, how the kidney is gonna respond to that. Okay, you ready for that?
Mm-hmm.
Okay, so the kidney is like a Katrina switch. It's like a switch. Okay, so if you have low blood flow coming to the kidney, because if the heart can't pump blood, do you think the blood flow is going to be high or low? It's not going to have a lot of flow to the kidney. So when you don't have a lot of flow to the kidney, decreased flow, what do you think is kidney going to be happy or sad about it?
It's gonna be sad.
It's going to be angry, okay? It's going to be pissed off. So the kidney mechanism of being angry, what is it gonna do? It's gonna release enzymes called renin. What renin is gonna do, gonna convert the angiotensin 1 to angiotensin 2. So let's just make it for simplicity. It's gonna produce angiotensin 2. What angiotensin 2 is gonna do, it's gonna pressure the heart more. It's gonna increase the heart pressure on the heart by constricting, from its name, angiotensin. It's gonna constrict these arteries to produce more flow to the kidney, and it's gonna produce aldosterone, which retain fluid. It's going to add more fluid to the system. So this kidney mechanism, it's compensatory mechanism, but it's not good for the body. Why? Because we already have a lot of fluid that we can't handle. The heart can't pump. Okay? So when this mechanism, what do you think it's going to do to the patient? Is it going to help his symptoms, or is it going to worsen it when you add a lot more fluid, when you can't even handle your own fluid? What do you think? Huh?
Make it worse.
Excellent. So it's gonna make it worse. So the symptoms gonna be worse because of this compensatory mechanism. So what we're gonna do is that simply we just add medication like AC inhibitor, which means angiotensin converting enzyme inhibitor, that block this pathway. It's called ACE inhibitor. We can block that. Or we can use the beta blocker just to slow down the heart rate. Or we can go to the kidney tubules and making the kidney secrete more fluid to the system, make you urinate more, like we use the loop diuretics. We use diuretic because we want to get rid of the fluid. There's a lot of fluid in the system. Our goal is to get rid of it. Or we can block the aldosterone by adding aldosterone antagonist like spironolactone. Okay? Or if all of that failed, like, so number one, we start with AC inhibitor beta blocker, and then if that didn't work, then we add diuretics. We make the patient pee more, go more to the bathroom. If that didn't work, then we do aldosterone antagonist. If that didn't work, then we use, it's called bidilators, which means it dilate the veins and dilate the arteries. For example, hydralazine and nitrate. So these are to dilate arterioles and venules. This way you release the pressure on the heart. And if that didn't work, last resort is gonna be either dopamine or dobutamine, which basically stimulate the heart contractility. Or we can do assistive device that connect to the heart that help it contract. Or we can do heart transplant. We give them brand new heart. Okay, so that's basically the summary for heart failure management. Okay, so these are the drug management for heart failure. Now, what do we do, like when you examine a patient after you give him all of these medications and everything? What are you looking for on physical exam? So on physical exam, what we're gonna do, first we do head and neck and everything. We just check that, and then we do the heart and lung exam. For the heart, we look for S4, sound 4 in the heart, because heart failure can be associated with that. And then for the lung, what are we looking for? Is it a clear lung sound or is there any crackles? Okay, we gotta see that. If there is any crack, if the patient had a clear lung sound, we tell them, okay, I didn't see any crackles, there's no fluid in your lung, this means your heart failure is well managed. And then we examine the extremities, which mean the legs. We check the pulses. Legs, we look for what? For swelling. Is there any swelling? If there's any swelling, this means the heart failure is worsening. Okay? Now for the plan, what do we do like to manage heart failure? There are some things called the BNP, brain natriuretic peptide. Usually it's more than 500, and that indicate congestive heart failure. if it's less than 100, this is not congestive heart failure. BNP, brain natriuretic peptide, is the body mechanism telling him, oh, I have a heart failure, so I need you to help me. So this is one thing. Another thing we do echocardiogram. Echo to look for ejection fraction. That's very important. And we make sure if is it systolic heart failure or is it diastolic heart failure. So we tell the patients, we're gonna order echo, we're gonna check your ejection fraction. Ejection fraction mean like how much blood you get. Like for example, we get 500 ml blood, and how much can you pump. Like if you pump 300 ml out of 500 ml, that means you're good. But if you pump only 100 ml out of 500 that you get, that's really bad. So this ejection fraction is low. So it's going to divide by 100 by 500 and you're going to see. But 300 by 500 usually more than 55%. Normal ejection fraction more than 55%. Okay? What are the other things that we want to look for? We can even do the cath, left heart cath, just to check if it's a heart attack that caused the heart failure. Okay? And then the other thing we check their hemoglobin. We order that. We order the potassium. And then something very important, we look at the dry weight. Because usually, for example, if you had the patient on his previous admission, his weight is 160 pound. Now today he's 180 pound. Now you know that they have 20 pounds of extra fluid. So now you know your goal is to lower down this 20 pounds. Okay? And then you gotta make them check their weight daily. Check weight daily. It's very important here. Now we talk about diet. What do we recommend patient with a heart failure? What diet do we recommend? We usually recommend less than 2 grams of NaCl per day, which means salt. Less than 2 grams of salt in a day, and less than 2 liters of water in a day. These are the dietary recommendations for congestive heart failure. So we gotta tell the patient when we examine them, tell them, oh, if they don't have crackles, tell them, oh, you don't have crackles, which mean like fluid in your lung. You don't have swelling, which means there's no fluid backing up to your legs. That means your heart is pumping blood enough. Tell them we're gonna do echocardiogram just to look at your heart motion. Tell them we're gonna check for your hemoglobin, check your potassium, check your weight, daily weight, and then educate them about diet. Less than decrease salt and water. Less than 2 grams of salt and less than 2 liters of water.